Hello, my name is Hoch De Keyser, and I'm the Director of Wellbeing at the Breathing Institute at Children's Hospital, Colorado. Today I'd like to talk to you about burnout. Burnout is an increasingly recognized occupational health disorder, particularly in healthcare providers. Burnout is categorized by the WHO and the often used Maslach Burnout Inventory into 3 dimensions: energy depletion or exhaustion, which is also known as emotional exhaustion; mental distance from the job, negative feelings or cynicism, also known as depersonalization; and reduced professional efficiency, also known as reduced personal accomplishment. Studies unfortunately show that burnout rates in pediatricians are nearing 50%. The effects of burnout on both healthcare providers and patients are significant. They range from increases in patient mortality and medical errors, impaired professionalism, reduced patient satisfaction, staff turnover and reduced hours, and even depression and suicidal ideation and motor vehicle crashes. Therefore, it's clear that the implications of burnout are severe on both a personal and system-wide level. There are some groups who have been identified as higher risk for burnout for a variety of reasons. Racial and ethnic minority providers are subjected to increased rates of racism and offensive remarks from patients and their families, which is a risk factor for burnout. Women, those with children under age 21, and mid-career physicians may be at the highest risk for challenges with work-life integration, which may also contribute to their increased risk. Trainees work long hours with frequent sleep deprivation, which may also contribute to increased risk in these groups. Finally, EMR and payer challenges may put those in private practice at higher risk as well. There are a number of personal and systemic changes that can be made to improve working conditions for healthcare providers. Let's start with some evidence-based personal interventions. Interventions based in positive psychology have been found to improve markers of personal well-being and depression. Activities rooted in positive psychology include gratitude practices, practicing acts of kindness, fostering personal connections with colleagues, and connecting with experiences of awe. Mindfulness has been associated with decreased PTSD in those who work with children at the end of life and may also improve patient-provider interactions. Providers should make an effort to focus on their own mental and physical health as well, including attending medical appointments for themselves and seeking mental health care when needed. Effective mentorship for trainees may also be helpful in overcoming their struggles. If mentors share their own struggles and failures with the trainees that they work with, it may help trainees overcome their own feelings of imposterism. At an institutional level, hospitals can work to adopt policies to protect healthcare workers from violence and discrimination. Additionally, they can foster community and connection amongst colleagues, creating networks that allow healthcare workers to lean on each other in challenging times. Peer support programs are an evidence-based way to accomplish this. Institutions can attempt to improve work-life integration by adapting to personal circumstances, including adapting to hybrid work or attempting to provide reasonably priced and accessible childcare. Paying workers equitably is key to job satisfaction. Reducing EHR and administrative burden is important as well. This is one of the reasons that finding meaning is so important. The more work that we do that feels meaningful and ties back to the reasons that we started to do this work in the first place, the less likely we are to burn out. This study showed that as meaning at work decreased, risk for burnout increased, and in a linear fashion. At a national level, there is work to be done to destigmatize mental health disorders in healthcare, starting with lobbying state medical boards to eliminate licensing questions that could discourage healthcare providers from seeking care. Public entities can focus on clear and concise messaging around public health issues such as vaccines in order to combat misinformation. There should also be advocacy at the national level to reduce administrative and non-patient-facing work burden, such as working to eliminate prior authorization requirements. In conclusion, burnout rates in pediatricians are unfortunately high, and the impact of burnout can be significant, both from a personal and a society-wide level. However, there are interventions that can help. Those in positions of leadership should consider how they can use those positions to improve systemic level concerns. And we can all work daily on finding ways to improve our personal wellness. By addressing the issue on multiple levels, we can find ways to sustain our healthcare system and ourselves into the future. Please don't hesitate to reach out to me with any questions that you might have about this. Thank you very much.